Welcome back to the Healthy Chicago podcast, where local health professionals and their guests discuss the latest public health issues affecting Chicagoans.
Welcome back to another episode of the Healthy Chicago podcast. I'm your host, Star Cervantes, and I am the Antimicrobial Stewardship Pharmacist for the Chicago Department of Public Health. And I'm very excited to have two special guests today in honor of Antibiotic Awareness Week, which is November 18 to the 24th. We have our special guest, Dr. Stephanie Black, who is our clinically trained infectious disease physician and current interim deputy commissioner and director of
Interim Chief Medical Officer and Director of the Disease Control Bureau.
Okay, there we go. And we also have Dr. Michelle Funk, who is our clinically trained veterinarian for our program right now, the healthcare settings and congregate settings. She is our medical director. So thank you guys for both being here today.
Thanks for having us.
Yes, I'm so excited because we are talking about, I know we talked last time on the podcast about antibiotic stewardship and resistance, kind of what that is. And we are glad to bring you guys back today so that we can learn more about that and kind of like what your role here is at the health department. So Dr. Black, if you wanted to go first and kind of introduce like what you do and why you got into stewardship.
Sure. So as a leader of the Disease Control Bureau, we oversee response to outbreaks and specifically drug-resistant infections in people who are at risk. And usually that involves older individuals, people with lots of medical conditions who may reside in nursing homes, usually people who require a lot of hands-on care. And I also serve on a presidential advisory committee called the Presidential Advisory Council on Combating Antibiotic-Resistant Bacteria, or PACARB. And this group really focuses on trying to stop the development of resistance to antibiotics around the world. Because we see these impacts both in low-income and high-income countries.
Yeah, and that's a good point. We have resistance like we talked about last time on the last podcast episode. It's not just in people, but also in animals too, and in what the foods that we eat, which is great because now that we have a veterinarian that can cover this is like something that's really eye-opening for us to hear as well. So, Dr. Funk, do you want to kind of go through what you do?
Sure. So as has been mentioned, I'm the medical director for healthcare and congregate settings. But the way that I really got interested in antimicrobial resistance is that I actually have my master's in public health with a focus in epidemiology. And I'm really interested in this concept of One Health, which is basically the idea that human, animal, and environmental health are all related. Because bacteria and actually fungi too, which is something else we'll be talking about here, are very common in the environment. They can be spread between humans, animals, and environment. And so it's really important that we address this public health problem from that lens. In addition to working with this team and as part of my role, I have also joined the Council of State and Tribal Epidemiologists, One Health, Antimicrobial Resistance and Stewardship Task Force to really help to support addressing this problem through multiple lenses.
Yeah, and I know we talked a lot about resistance and kind of like what that is, but if you guys wanted to break it down for our audience on like what is antibiotic or antimicrobial resistance, so that way we can kind of get a better understanding of what we're kind of dealing with here.
Sure. So antibiotic resistance occurs when germs, such as what we mostly think about as bacteria, but as I've mentioned, fungi can also develop resistance to antifungals. And when that occurs, they're no longer able to be killed by either the antibiotics or the antifungals. And as a result, we can no longer treat certain illnesses that we were originally able to treat. It is very common for bacteria and fungi to be, part of our normal environment or part of our body, and sometimes they do cause illness. However, in many circumstances, they're just kind of a normal part of our normal existence. And so when those bacteria and fungi adapt to cause, these to become resistant, they could potentially survive and multiply, and then they can share some of this information with those bacteria or funguses that are not supposed to be, part of our normal environment. And so this can cause some significant problems.
Yeah. Well, thanks for sharing that. I wanted to see, Dr. Black, do you have anything else to add? Because I know that you've done a lot of work in this as well. So I wanted to hear what your thoughts were on what is antibiotic resistance.
Yeah, and so just as Dr. Funk pointed out, bacteria in the presence of antibiotics, especially when people don't finish taking their full course of antibiotics, so the infection that is trying to be treated, those bacteria or fungi had a little bit of exposure to the antibiotic or antifungal and can actually learn their way around and can survive then and then multiply because bacteria and fungi, like other organisms, have progeny, and their offspring can genetically acquire the ability to be resistant. And so they then multiply, and that's how people develop resistant infections.
We don't want them to multiply, for sure. That's the one thing that we're trying to prevent that from happening.
Yeah, so the bottom line there is that it's super important to finish courses of antimicrobial therapy, or not take them if they not even be prescribed them in the first place if there isn't an indication to take them.
Yeah.
And I just wanted to add one thing that I've heard about antimicrobial resistance. I've heard that some people think that you, as the person or the patient, can become resistant to the to the antibiotics, and that's actually a misconception. So it's important to know that we're really talking about the bacteria or the fungi, we're not actually talking about the people or, in the veterinary sense, the animal.
Yeah, the puppies. So, I mean, you guys have both brought valid points. I guess one of the other questions that we had is why should people care about resistance? I know we know why, but if you guys want to explain to the public, like, why is resistance important and, like, what are the things that they should be looking out for?
Sure. So antibiotic resistance has been sometimes considered to be an invisible pandemic, meaning that we don't always directly see the side effects of not having antibiotics that are working for some of our patients. So, when we think about antibiotics and the history, it's really one of the most important medical discoveries from the 20th century. Yeah. Penicillin was discovered in the 1920s, and before antibiotics were widely available, infectious diseases were some of the most important contributors to illness and death. Since the antibiotics have become available, there's been a significant increase in the lifespan of humans. And we think about, some of our routine infections that we take for granted, but things like strep throat or urinary tract infections or routine injuries and wounds. And if we didn't have antibiotics to treat them, we can imagine that would lead to a pretty severe outcome.
I remember talking about that with Dr. Luna, too, in the last episode, that there's a big misconception, especially like in Hispanic populations and communities, that we, like, you get a cold or you get like the sniffles and right away you get an antibiotic. And that's just like how I grew up, and that's what led me to love stewardship, too. And I feel like this is a great topic for us to kind of like educate the public and educate everybody out there that why, they're good for us, but why they can also do a lot of harm. Do you have anything to add, Dr. Black?
Yeah, I just want to pick up on another point that Dr. Funk made about the invisible pandemic. That to kind of contrast with climate change, which people see day to day. You can see a hurricane, you can see flooding and the heat that we've experienced. And I think that the problem with realization of antimicrobial resistance happening is that these are microbes that we cannot see. And even though we experience the poor outcomes because of it, this is all happening under our radar. But in fact, it's really not. The issue of antimicrobial resistance affects many other public health issues and illnesses. For example, in modern medicine, we have better and better medications and treatments to treat people who have a diagnosis of cancer. And because they are taking medicines that can suppress their immune system, they need to take prevention or prophylactic antibiotics. And it's crucially important that they have those antibiotics available so that they can be able to be treated for their underlying disease, which is cancer. And antimicrobial resistance also affects child and infant mortality, and also food insecurity. We need antibiotics to treat, as has been mentioned, our pets, but also the animals that are used in the production of food. The food supply, and also antimicrobials effect on poverty. So
it's really
many
interesting.
far-reaching issues.
Yeah, how it all interconnects, like what we take and what the animals are given and everything, and that's kind of what the basis of the One Health approach that Dr. Funk was mentioning earlier,
right.
And why stewardship is so important. And can you guys tell our listeners what, I know we talked a lot about resistance, but moving into the segue of what we can do to prevent the resistance from happening as stewardship. So can one of you guys kind of explain what stewardship is and why it's important?
Sure. So, in thinking of the problem of antibiotic resistance, there's a few different things that we should be able to do. And some of that includes infection control, so that we can prevent some of these issues from happening to begin with. And then the second part of that is really addressing, exposure to antibiotics, which is kind of the reason for stewardship. As Dr. Black has mentioned, the more that some of these germs are exposed to antibiotics or to antifungals, they're more likely to develop some of these ways to essentially combat their ability to respond to or to be treated with antibiotics. When we think about this in terms of One Health, we have, the CDC and the World Health Organization and our own Chicago Department of Public Health that really thinks about some of these issues from the lens of human, animal, and environmental health. And so it's kind of trying to help support those different types of lines of work in developing policies that can, improve the use of antibiotics, to improve infection control practices, and really to kind of even to increase access to things like vaccine, which are critical for preventing infections.
Well, you mentioned infection control, and I just want to sort of highlight maybe more about what that specifically means for our listeners. And so meaning clean your hands. So keeping that hand sanitizer in your purse or your pocket, and washing your hands when they get soiled. You mentioned vaccination is incredibly important, and some of these drug-resistant infections can be actually prevented by vaccine. So, for example, the pneumococcal vaccine prevents against infections with Streptococcus pneumoniae. Using antibiotics appropriately is incredibly important, as we said, that people finish a course of antibiotics if it's decided that they really need them. And if you have a question about, you have a cut that is, draining a lot and you want to get that checked out, call your provider and have it checked out. But if infection is there, really there is typically, redness and swelling and pain and drainage and all of these kind of symptoms that go along with it. And even so, it may just need to be drained, whatever infection's going on, and antibiotics may still yet not even be indicated sophisticated. So, and it's really important that we're not just taking a course of antimicrobials for a viral infection. And yet, if somebody has something like influenza, which is a viral infection, there's actually antiviral treatment that people can take to reduce that course of illness. But it has to be the right drug at the right time for the right duration to prevent resistance from developing. It's important also to stay healthy when traveling. For that reason, checking with your provider before you travel to see if there are certain vaccines that you might need. And then also preventing infections related to sexually transmitted infections.
Yeah, I think those are really good points, especially you highlighted that there's antivirals. So like I think that's a common thing. Like we categorize it as antimicrobials because that includes antifungals, antivirals, antibiotics, and like an antibiotic will not help treat a virus because it works specifically for bacteria and vice versa, like the virus to the bacteria. So that's a really good point. I like that you brought that up because I feel like that's a common question that I would get asked when patients would come up to the pharmacy and be like, I have this, I think I need an antibiotic. It's like, well, maybe, like it depends, like if you have a virus, if it's a cold and it's something that is just going to pass through you and you might not need an antibiotic. And then also if you do need an antibiotic, to make sure that you're taking it, because then sometimes they start to feel better and they're like, okay, I don't need to finish my 7-day course. And that's also a common issue that we see because that's how the resistance happens that you guys were talking about. So
yeah, and so important to mention just while we can about influenza, right, and COVID vaccinations, because if you can prevent that infection to begin with, then you don't have consequences. And importantly, some of those viruses, when people get infections, can actually lead to secondary bacterial infections. Because when those viruses get in our system, they can actually really break down the lining of our respiratory tract, which is what lets the bacteria get in the first place. So all to say, get those vaccinations.
yeah, good points. Do you have anything else to add, Dr. Fung?
Yeah, I think also when we think about this, from the veterinary perspective, we use a lot of the same recommendations as occur in human health. There's a lot of illnesses that, cats and dogs can get, that your pets can get, that are not always treatable by antibiotics. Some of the same respiratory illnesses, upper respiratory illnesses, sometimes some diseases can mimic as bladder illnesses that are not infectious. And so I think really the take-home message here, too, is just to establish a good relationship with your healthcare provider. Yeah. So that way, if you do have an illness for whether it's your child or whether it's your pet or whether it's yourself, that you know who you can talk to and really get the correct diagnosis and treatment. And to also establish that level of trust because there might be some circumstances in which antibiotics are not appropriate, or maybe they can be delayed by your healthcare provider. And so being able to have that conversation ahead of time and then, know what parameters you have to follow in order to know when you want to check back with your provider. So again, continuing to, have that initial relationship can be beneficial, not only for you, but also for, the rest of public health for this issue. Yeah,
definitely. So what advice do you guys have for the public? I know you talked about like washing your hands and getting your vaccines, but is there anything else that you guys would recommend specifically that people can do to prevent the resistance from happening and to be good stewards?
Providers want to be responsive to their patients. And so if you have a question, like Michelle was saying, like develop a relationship with your provider so you can ask questions when you're concerned about potentially having an infection, but also understand that not every time that you feel sick do you actually need antibiotics. Right. Or even every time, as I was talking about that swelling and redness, sometimes it just needs to be, some warm compresses and it will get better. That being said, as we've also talked about that antimicrobials can be life-saving and they need to be reserved for when they're truly needed. They need to be available for people when they have to take medications that suppress the immune system.
Yeah.
So important to do your part in, only asking for, evaluation or asking when you have a question, or just asking the question, do I really need this course of antimicrobials, and not always expecting it.
Yeah, I think that's a valid point. Like being your own steward and being your own advocate for yourself too is something that I always encourage patients to. It's like if you feel like you need it, like you can always have that conversation and like talk to your provider or even like educate yourself.
I think one other point to appreciate is that actually we need the bacteria to be in our bodies.
Right.
We actually live with bacteria in our, gastrointestinal tract. They're friendly. They keep us feeling well. Actually, you can get some really pretty nasty cramps from not having our routine bacteria there.
Yeah.
And people may have experienced that if you've traveled internationally and you kind of eat some new food, you get some new flora, and it's kind of a bummer when you get back and your kind of GI tract is readjusting. And sometimes even those illnesses require antibiotics. So important, again, to check in with your provider. But we need to save those antibiotics for when they're truly necessary.
Yeah. Like that's a good explanation of that, because I feel like a lot of the times the patients would ask too, I'm getting prescribed an antibiotic, and then the provider would be like, you also need a probiotic for that reason, or like eat yogurt or things like that, because the antibiotic is clearing out all bacteria, like every bacteria for whatever it's being treated. And I feel like that's like a good point that you said. We do need some of that bacteria, and that's why they usually recommend like a probiotic or like eating yogurt and making sure that you're getting that bacteria back again, because we don't want it to be completely eliminated, but we want the bad ones to go away, but the good ones to stay. Yeah.
Right.
Good point. Anything you guys want to add? I know we are almost at the end, but if anything that you guys wanted to highlight specifically for Antibiotic Awareness Week this week that's going to be happening, any last minute points?
I think it's just important to keep in mind, this issue. As you go forward and engage with healthcare systems, again, whether that's your own human healthcare system, whether that is, with your pet's veterinarian, but just to continue to take those actions and just be mindful of your use of antibiotics.
Yeah, totally.
And I would just conclude by saying, to keep this issue in mind for the patients who have experienced difficult to treat infections. Their stories are truly terrible with, going in and out of hospitals, trying to get to the right antibiotic because they have these drug-resistant infections. So though this is kind of a silent pandemic for many of us, there are people who are affected by this every day. And just like climate change, really, it is a global problem that is inexorable, and we need to do what we can to stop the spread of drug resistance.
Yeah. It's really inspiring, the work that you guys do. I'm very proud to be on this team, and I'm really happy that we get to fight antimicrobial resistance together. But thank you guys both for being here today. That's all we have for today. So join us next time as we probably talk about One Health with Dr. Funk. So that's all we have for today. Thanks.
And that's our show. Thanks for joining us today. Don't forget to rate and subscribe wherever you find podcasts. I'm Dr. Bora, and we'll see you next time.